morning, good afternoon, good evening. Thank you to Great Panthers NIC for inviting me to be part of this commemoration. My name is Hyobum Jang. I'm medical officer at the World Health Organization, Geneva, where I lead the organization's work in long-term care under the UN Decade of Healthy Aging. I'm speaking from Geneva, but the question that brings us together today crosses every border. 5 years ago, what does it mean to remember the lives lost in long-term care during the COVID-19 pandemic? And what does it take to make sure that loss was not in vain? In many countries, the pandemic struck older people in long-term care with a brutality we have rarely seen it before. On average, across OECD countries, around 40% of all COVID-19 deaths the first year of the pandemic occurred among long-term care residents, a small fraction of the population, but carrying an enormous share of the loss. In some of the worst affected countries, the proportion was far higher, at most 70 to 95%, such as in parts of the United States. And those are only the numbers we can count. In most low and middle income countries, we still don't know the full scale. Long-term care that is largely invisible to data systems, to regulation, and often to policy itself. The pandemic did not create that visibility. It exposed it. What COVID showed the world was that long-term care was the most neglected part of our system and health and social systems, underfunded, understaffed, disconnected from health services, built around buildings rather than around people. With a workforce mostly women, mostly underpaid, many of them migrants, carrying impossible burdens, and with residents and families too often denied a voice in decisions about their own lives, including in their last weeks. Those failures had human names and human faces. The documentary you made and the work of every other speaker on this panel prove it. Since then, many countries have acknowledged those failures. There have been inquiries, reform commitments, new investment in infection control and workforce, and in some places, ambitious attempts to transform long-term care systems altogether. But those efforts remain uneven, often partial, and rarely matching to the scale of what the pandemic revealed. The gaps remain within countries and even larger between them. This is why the World Health Organization has stepped in. During and after the pandemic, we issued guidance on infection prevention in long-term care settings, a framework for the integrated continuum of long-term care, and a package of interventions. Those laying out what governments need to put in place, from financing, workforce to coordination across health and social systems. But guidance and frameworks alone are not enough. The world has never had a single agreed reference for what good long-term care looks like, what people receiving care have a right to expect, and what governments and providers are accountable for delivering. That is why the World Health Organization is now developing the first global standards for long-term care. They address governance and financing, the workforce, the quality and safety of services, the rights of older people, and support for their families and carers, and how systems prepare for the next emergency, because there will be another. The consultation draft, the Global Long-Term Care Standards, is open now, and it is open to everyone. Civil society, advocates, residents, families, workers, researchers, and governments. The window runs until later this year. You can submit your views directly to the WHO website, and you can also channel feedback to partners like Great Enders NIC. You can help gather and amplify the voices of the members and networks. Everything we say will be analyzed and we shape the revisions ahead of the final publication planned for 2027. So my ask is simple. Please read it, challenge it, tell us where it is weak. Tell us where it misses what you and your families live through. The strongest version of this standard will be the one shaped by people who refuse to look away. 5 years ago, an enormous number of older people died, often alone, in the very places that were supposed to care for them. We own them, much more than commemoration. We owe them a system that would not let it happen again.